Hi guys, Don here. Welcome to Podiatry Practice Mastery, where we're helping you get your practice to the $1 million mark or $2 million mark and beyond. Want to do a deep dive into a couple of questions that Muhammad asked me. He is a podiatrist and he's been in practice. I don't know all the details, but one of my good friends, Jim McDonald, he works with Podiatry Growth, which is a website company. He sent him over, sent some questions. I always like questions. This gives me fodder for the podcast. So once again, if you have any questions, you can certainly email me at don@Podiatry Practice Mastery. Another thing that you can also do is come and visit me in the office if you want. I had a doctor visiting me today. Kind of gave me a lot of energy, and I hope he got a lot of good ideas. I'm going to ask him in the future to give a little kind of shout out about what his experience was. So Muhammad's question was, Don, when you're introducing cash pay treatments like shockwave or biologics, what's the best way to communicate pricing and value without patients being sold? And then also this kind of a follow-up to that is, do you prefer the provider to lead the conversation or have a medical assistant do it? And how do you train them? Okay, so I'm going to try to unpack this for this doctor. So in terms of doing high ticket items, which is something, frankly, we are not trained out of residency. In residency, we're trained to do surgery, and we maybe visit a little bit of people's practices, but we're really not sure how to talk about high value services. And so because of that, many times we buy these expensive machines and we don't know how to offer them to patients if it's not covered by insurance. If it's covered by insurance, anything is easy to sell. My joke is, so if it's free, it's easy to sell, but if it's not free, it can be a challenge. So I'm going to go over kind of some ways of not being salesy and the things that kind of work best in my hands. And I've also asked a couple of other people that are in my mastermind about the aspect of using staff, because I don't use the staff. I do most of it myself, but I like the idea of using staff. So let's talk specifically about shockwave and about amnio. But you could like transition that to Swift. You could transition that to like MIS surgeries that are self-pay in the office. You can transition this to anything, okay? So the first thing I would say about this is you have to believe in what you are offering. So I cannot emphasize this high enough or big enough. If you are offering something that you don't believe in or is not good or you're not getting good results, it's better not to offer it, okay? If you wouldn't do it for your mother, it's better, and making your mother pay for it, it's better not offering it, okay? So that is number one. So number one is belief. So if you believe in this thing, you are going to offer this thing and you're going to have conviction. And that conviction comes through. If you don't have the conviction, you either have to get that conviction or you have to get it from someone else, okay? So you can get the conviction by going to different types of courses or watching webinars or learning about the technology. You can either learn it or you can earn it. So you can learn it like Shockwave. You can go to the Shockwave conferences. You can binge watch some of their documentaries online. You can come visit me and see me do Shockwave, and I really believe in it. And I'm going to give you two examples. One would be Shockwave, which I really believe in because I know it works, and so I can offer that. And another thing would be laser fungal toenails, which I don't have a great belief, whereas other doctors have a great belief about it. And I was listening to this other doctor, Marco, talk about it, and he's like, wow, this is the best thing ever. And I'm like, I wish I had that conviction, and then I could offer it all day long. So number one is belief. Okay, so once you actually believe, and if you don't believe, like offer it for less expensive or for free until you do believe. That's what I did with Shockwave. I did it basically for free for a little bit because they gave me as a trial. And I think like for example, they gave us a recent trial. I think it's called Amnio DPM or one of these amniotic things. They gave us like samples, and I'm gonna try this out to see if it really works because I don't believe it, right? So I want to try it out, and that'll increase my belief. Once I have the belief, then I can offer it to patients with conviction. Okay. So that's number one, would be having this belief. So then the next step would be in, okay, I believe in it. Now, how am I going to recommend it to patients? You have to figure out where in your treatment process you are recommending it. Typically, high value options, I am not recommending visit 1. Okay, it's usually visit 2, unless you are seeing a lot of second or third opinions. So that's where my treatment sheets come in. So the treatment sheets I use, they are kind of a guiding all of my treatments. And so for plantar fasciitis, on this treatment sheet, you're going to have ways to repair the plantar fascia, And then you're also going to have other types of things that can be done to reduce inflammation, reduce tightness, helping with the reducing impact with shoes and orthotics. So all these other things are on my treatment sheets. Once again, if you don't have my treatment sheets, you can go to Podiatry Practice Mastery. You can get that one of my free downloads. It's in there. But these treatment sheets, you can make your own. Put them on Google Docs. Just pretty much take 2 columns and put in the stuff that you do in the categories, and that's a treatment sheet. And so on this, I'll tend to do on the first visit kind of what they should do in phase 1. And then I'll say, okay, and if this doesn't get better, we're going to go to phase 2. And I would recommend these other things for phase 2 and for this reason. So that is how I use my treatment sheet. So I'll talk about, how phase 1, we're going to do icing, anti-inflammatories. And then for phase 2, we are going to do other types of things based on how you're feeling. Okay. With the treatment sheets, you kind of go over that. So I print them out. I actually do it with the patient. And then if there's other things that need to be explained, you might want to use like a foot model. You might want to use a picture. I use something called a patient presentation, which are actual like PowerPoint slides. You can do it on your website. You can do it however you want to do it. Okay. There's an infinite amount of ways to share and explain things to patients, and everyone has their own way. But once you kind of go through this, so the first visit, they're probably not going to do it unless they're a second or third opinion. If they are, you check off all the other treatments, and then you say, okay, this would be the best thing for you at this time. And now comes in the play of, do you go over prices or do you have staff? So I know there are some doctors, and this is why I recommend the treatment sheet. So if you check off shockwave or amnio, and if you check off orthotics, then the staff comes in and they can go over what's on that treatment sheet. I would recommend doing it in the treatment room if you have a staff doing it. So if you have a staff doing it, you would be done. They would come in, then they would go getting the authorization for those things, going over the pricing, the consenting, and then either you're going to do it that day or you're going to have them come back a different day. So a lot of times what I do is I will have, like the second visit, they'll come in, they're going to need shockwave, and I've already planted the seed, they're ready for it, and then the staff comes in and goes over the consent, and on the consent is the price. So I usually just say, hey, the way I do it is I say shockwave is $250 a session, and I usually do, between 3 and 6 sessions. And if you prepay, you can get 10% off. So we do a benefit. If they prepay, they can get 10% off. And that's as much of the stuff as they want to do. So if they do amnio, shockwave, and orthotics, I'll give them 10% because it's just easier to prepay for everything, get it all set up. And it just saves my staff time. So I think it's worth that. And for patients as well, it's just easier, a one-time thing. So I usually say that to patients. But if you want the staff to come in, they have to be really trained and being confident. It's probably not going to be every single staff person, right? Because it's not just saying, okay, hey, this is $1,500. Because the thing is many times staff are going to project their own feelings about things. Meaning, if they wouldn't pay $1,500 for 6 sessions of shockwave, they're probably going to talk out your patients or into your patients out versus in. So you have to really be careful who you're letting go in there. They should try it themselves. They should be sold on it. Maybe they are the ones that are doing the shockwave for you. That would make sense. If you're having a staff do the shockwave, they know it's working. Have them go in and consent and answer any questions for the patient. So one way is having the staff come in. I usually tend to come in and talk to them about that. So I find that the treatment sheets are very valuable. I think the confidence is very valuable. And another thing would be like imaging. I find that imaging, not so much x-rays. I guess x-rays can help with like orthotics. You can show the mid-column faulting. You can show the talar head uncovering. And something cool that I learned about x-rays today, within my x-rays, I kind of show the angles, and I do what I call a kind of a summary, a verbal summary. I call it a dialogue. Okay, as I'm treating, a treatment dialogue. So as I'm treating, I'm dialoguing to my scribe. But one thing I learned that's kind of cool today is I've always had patients take pictures of their x-rays or their ultrasounds with their phone because they want to show people. But now there's a way I can add in writing. I never knew this. So you can just add text in. So what I did today is I wrote in there, flat foot and talar head uncovering. So they could kind of look up talar head uncovering. They could take a picture. They could show it to their husband or their wife. Like that's kind of a little bit of a nuance of having them take the pictures instead of printing them out. In the past, we used to print them out. We don't do that. But where I was getting at is I find that what really helps to sell, if you want to say it, shockwave is the ultrasound. So even if insurance didn't cover it, and for a lot of my patients they don't, they just pay cash. I do straight $100 if it's not covered, as many ultrasounds as I want. But if it is covered, that's gravy. like Medicare's covered and stuff like that. But a lot of my others, it's not covered because I'm not an official radiology reading it, and I haven't done the certification that takes like thousands of ultrasounds to read. But for the ultrasound, by doing an ultrasound, I can show the right and the left foot. I can show the thickening of the fascia, or the thickening of the Achilles tendon, the bulbous changes, the effusions, things like that. And that is what really sells it. So I can show it before, and then I can do the ultrasound if needed afterwards. So I think doing that type of an exam is really, really helpful for, once again, selling the procedure. Okay, so just to review, you have to believe in it. You have to do some type of imaging or explain it to the patient. And then you have to try other things first. So phase 1, I call that. And then they get into phase 2. And then when they're into phase 2, I use the treatment sheet to kind of check off the things that I would recommend. And a couple of other things that help, I guess, would be wording. You have the kind of these phrases for things. I find I have a lot of these phrases. So I learned this at one of the shockwaves, one of the Cure Medics conferences. I find that shockwave is about 82% effective, and it speeds up healing by about 50%. Like, I repeat that hundreds of times, probably a month. And those little phrases of because that kind of instigates or makes people think that it's very, very effective, which it is, and it speeds up the healing, which everyone wants. So everyone wants things that are going to work, so they have their confidence in that, and then they want it to speed up the healing. So those are a couple of things. You have to have little phrases that you say for each of these. So those are the things that I find work best for kind of explaining things without being salesy. And then I also went over using staff. I tend to go over the prices, but it's my staff that then goes over it. Now, I'm going to go do one kind of advanced version, which I got from Marco, my buddy, and he probably got it from someone else. But what he does is when patients are checking out, like for example, in ModMed, I would say, hey, patient's going to come back in 2 weeks. I recommend 6 sessions of amnio, orthotics on the third, and 6 sessions of shockwave, amnio at the second, and then orthotics on the third. I'll write that in the tickler as they're checking out, and the staff is going to say, hey, do you want to set up those shockwaves? Now, if they say no, what Marco does, which I really appreciate, he has this little form that they fill out saying that they declined what was recommended. So it really kind of shows the importance of doing what you recommend, and they're actually declining the care. So if they decline, and he has a little sheet, and it has kind of like a DME dispensing sheet, but you can check orthotics, you can check laser, you can check amnio, you can check shockwave, anything that you want them to get, but they're not getting, they can check that, and then they would sign that, have the patient sign it, and put their name on there. Why? So then you can call in a few days and just check with them and make sure that they didn't want that. So it's kind of like use the actual papers to follow up with the patients in a few days. I really thought that was like a smooth thing that he told me. I personally am not doing that. I want to do that. I just haven't got around to doing that yet. So anyway, once again, I hope this was helpful. As I've mentioned, I always try to give more stuff for free than most people are charging for. If you want to learn more, you can go to podiatrypracticemastery.com. I have some free resources there, or just binge watch more of these podcasts. Okay? Once again, we will talk to you guys soon.